Hello everyone and welcome back. In today's teaching, we'll be discussing the pectoral girdle, also known as the shoulder girdle, and this is the bony ring that connects the axial skeleton to the upper limb. If you recall in our last class, we said the axial skeleton is the central framework of the body, and with this, the other appendages are attached. So we're using this outline, we're talking about the bones, the joints, the movements, the muscles, and the ligaments. So starting with the pectoral girdle, the definition once again is a bony ring that connects the axial skeleton to the upper limb, and it allows for mobility and muscle attachments. So moving to the bones involved. So what are the bones involved in the pectoral girdle? Number one is the scapula, and number two is the clavicle. So this is the diagram illustrating the clavicle, and this is the diagram illustrating the scapula. So by definition or by description, the clavicle is an S-shaped bone that connects the scapula to the sternum. It has two ends. Number one is the sternal end, also known as the medial end. So I recall that the medial end is the end that is closer to the midline of the body, and a lateral end, also known as the acromial end. So the first bone involved in the formation of the pectoral girdle is the clavicle, and this clavicle has two ends, the sternal end and the acromial end. We'll still discuss the osteology of these bones in another class, but let's focus on this for now. So the next bone involved in the formation of the pectoral girdle is the scapula, and the scapula is a triangular shaped bone that has a superior angle. Superior angle we call for our class is from closer to the head. Then we have the inferior angle, and it covers rib 2 to 7. So once again, the bones involved in the formation of the pectoral girdle, they are the clavicle, which is the head-shaped organ. It is palpable and subcutaneous. It has two ends, the sternal end, also the medial end, and the acromial end, which is also the lateral end. The second bone involved is the scapula, which is a triangular bone that has a superior end and a superior angle and an inferior angle, and also the graded cavity, and it covers from rib 2 to 7. So, having said that, let's move to the joints that can be found in the pectoral girdle. The first one is the sternoclavicular joint, and the second one is the acromioclavicular joint. In anatomy, we join two words together and then we cut them and find a way to make them make sense. So when we say sternoclavicular, we are talking about the sternum and the clavicle. So the joint between the sternum and the clavicle is the sternoclavicular joint, and the joint between the acromion of the scapula and the clavicle is the acromioclavicular joint. So once again, we have the sternoclavicular joint and the acromioclavicular joint. Now let's move straight to the movements that are possible in the pectoral girdle. And the movements that are possible in the pectoral girdle, they are elevation and depression, we have protraction and retraction, we have upward rotation, and we have downward rotation. So moving on to the muscles that are involved in the formation of the pectoral girdle, they can be divided into two main parts: the one that connects the axial skeleton to the girdle, and the one that connects the girdle itself to the arm. Once again, we have two types of muscles that act on the pectoral girdle, and they are divided into two main subheadings. Number one is the one that connects the axial skeleton to the girdle, and the one that connects the girdle itself to the arm. So the one that connects the axial skeleton to the girdle, they are labeled in black. So the first one is the trapezius, the second one is the lemitus scapulae, the next one is the rhomboids, and we have two. We have the rhomboids major and the rhomboids minor. So the one that connects the girdle itself to the arm, we have the craton muscle, we have the rotator cuff muscle, which is the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. We also have the teres major, we have the pectoralis minor, and the latissimus dorsi muscle. So once again, we have two muscles that act on the pectoral girdle: the one that connects the axial skeleton to the girdle, and the one that connects the girdle itself to the arm, and they are labeled in black and in blue, respectively, on the board. So let's go to the ligaments. We have ligaments that act on the pectoral girdle, and they involve the corapoclavicular ligaments. We have the acromioclavicular ligaments, and we also have the sternoclavicular ligaments. With this, I hope that you understand the pectoral girdle, and if you have further questions, please don't forget to drop them in the comment section. Thank you so much.